Look, the most common treatment is medication, but you have to take a broad view of these things. So you have to think about lifestyle and diet. We have to think about whether there are other conditions in the person that we have to treat. It's also important to consider the role of psychology and counselling. So a broad holistic view of the person and what treatments are likely to bring about improvement. But medications, because they work so well. Now, people will often say, oh, I'm a bit afraid about medications. I'm a bit worried about this. Couple of things to remember. Medications like stimulants release your dopamine. They don't add anything from the outside. You're not taking something abnormal here, unless you count the stimulant in terms of how it releases your chemical. So it's your chemical that's fixing your problem. It's not that you didn't have the dopamine, it's that you didn't release it. That's the issue, and the stimulant helps you to release it. So that's the first thing to remember. The second thing to remember is, although people get a dramatic response to medication, I don't think it's the most important thing ultimately. It's an essential prerequisite. The most important thing is what I call the dance. What's the dance? Well, it's the way you interact with everybody in your life, and you have a different dance with everybody. So think about it. If you change, then the people you interact with change, and in turn, you change in the way you interact with them, and in turn, they change, and so on and so forth. Let me give you a simple example. You've been the sort of person who's never been able to remember to get things from the supermarket. So your wife has stopped asking you. Now all of a sudden you can remember. So she starts to ask you, maybe to get 2 or 3 things. Goodness me, you come back with the right 2 or 3 things. What's going to happen? She's going to ask you more often, and she's now going to ask for 5 things. It's a simple example, but it's a real example. It's the sort of change that happens. Because what happens to you? You now start to think, ooh, my wife finally trusts me to do this job. So you change in the way you respond to that. Now, ultimately, that biopsychosocial change is by far the most important, and it is not medication driven.